first time you've used it, you're going to remove the top layer of the metal, and this is considered sterile. You're going to take your alcohol pad, you're going to wipe off the top of the bottle, then you're going to take your 1 cc syringe, depending on what dose you're on. 0.4 cc's for a 200 mg per ml dose is 80 milligrams, 0.5 cc's is 100 milligrams. And whatever dose that is, you would open your syringe. Don't touch the top because that's still sterile. You'll take your smaller number needle, which is a larger bore. Usually it's 21 or 22. You're going to open it, and you're going to take your needle and put it on securely. Then you're going to take your bottle, and you're going to see that your testosterone or estradiol, whatever you're injecting, has a water line. It's an oil base. You're going to take the needle cap off, and you're going to insert it in, and you're going to aspirate to a little more than your dose. So if you're at 0.4, you're going to go to 0.5 or 0.6. And then you're going to turn it upside down, take the needle off, and you hear that sound? That's the needle sucking, the vial sucking back in with the negative pressure so you don't lose all that product. You can use that next time. Put that to the side. You're going to take your larger numbered needle, which is usually around a 27 or a 28. Because it's an oil, it's a thicker substance, it needs to be through at least a 27 gauge needle. You're going to put the 27 gauge needle on the top. And this needle's a little bit long. Usually you'll have a half inch needle. This one's about an inch, so it's easier to see. Basically, you're going to find your dose. This person's dose is going to be 0.5, so you're going to gently point, and you're going to lose some product at the top until it's just 0.5, and you'll see it just drips around. You'll take the cap off. You're ready to go. Take your alcohol swab, clean off the area. Medial thigh is usually, you draw a line from your midsection to your outer hip, and wherever it meets in the middle, it's like mid-thigh, that's where most blood vessels are avoided. You'll take the needle, you'll put it in your thigh, or you can have someone else do it for you and do it in your hip. But the important thing to do is when you're going to cleanse your skin, place the needle in your thigh, and then you're gently going to aspirate so you don't get blood, to make sure you're not in a blood vessel. And you'll see a little bit of a bubble come up, and that means you're in safe muscle. And then you're just going to inject your product slowly until it's done. And that's it. Pull out the needle, put some pressure, and if you're bleeding, it's totally normal. Just put some pressure for a minute or so, and it'll be gone.